Hello, this is Naudi Aguilar at Functional Patterns, and for today's video tutorial, I'm going to be showing you guys a myofascial release technique for the gluteus medius. This region of the body tends to be very compensatory in most people's movements, specifically because we have grown accustomed towards sitting in a stationary environment. And when we involve ourselves in the stationary environment, specifically what we're going to find is that there's going to be certain dysfunctional patterns that happen within the body. As I mentioned in videos prior in regards to an anterior pelvic shift, when we have tight hip flexors, restricting the gluteus maximus on hip extension, the function of going from here to here, the body then is going to bypass this function from here to here and go directly into hyperextension and external rotation. If you look down at your feet right now, if you happen to stand up, you might notice sometimes that your feet begin to point outward. You may notice that your knees begin to point outward. It's a very common trait out of most people in our culture. Really what that is really just a secondary and third function happening in the body. When we hyperextend and externally rotate, that's just primarily a result of the gluteus maximus not functioning well because we have certain imbalances present in our body. Well, the muscles that we're going to focus on releasing today are going to help get our feet pointed outward and a little more straightforward. Now, to break this down a little bit further for you guys, I want you to think about that if I was operating from my primary function, my first function of the gluteus maximus, which is extension going from forward to the middle, right? That the gluteal fibers would be extending the hip going straight back. So my leg would be going straight back in this direction. However, if I wound up having a restriction here, it's going to inhibit that primary path of movement, which would be hip extension. So if I had tightness here, I would bypass this movement and then I would go into the secondary functions, but also the third function. And that's what's going to be the most important for us to pay attention to. So when I'm involving myself in this position where my feet externally rotate, rather than my legs kicking straight back, what I'm going to incline myself to do is actually use hip abduction. Hip abduction being this when my feet are standing straight forward, or I'm pointing straight forward. Hip abduction is going to be this. Well, when I deviate my femurs and I externally rotate them, then I'm essentially going to use hip abduction to propel me into my gait cycle when I'm walking. And that's going to create a whole compensatory state when I'm walking. And you're going to notice a whole lot of deficiencies that begin to happen. We tend to overload too much of the gluteus medius, too much of the quadratus lumborum, tend to overload the upper abdominal muscles that pull us into thoracic flexion. This is part of the chain of what also inhibits the function of our anterior and posterior oblique system. And that's something that I talk about with you guys all the time, that we always want to link those anterior and posterior sling systems so that way they can set us into gait, they can set us into throwing, into punching, kicking, pretty much all the functions that we need in reality. So this is going to be an extremely important myofascial release technique that's going to help us bridge that gap between getting from there to there, getting away from that external rotation and moving more into an aligned position when we involve ourselves in our gait and really just in most of our movements in general. So what we're going to be utilizing is a Theracane. You're probably going to need a wall specifically for this specific technique. Really what I want you guys to think about when you're doing this technique is that when you are involving yourself in it, you're going to pin down the Theracane right here to the wall. From there, once you pin down the Theracane to the wall, you're going to then set your hip directly into that. You're going to locate right here. You're going to notice that your pelvic bone is about right here, and you're just going to bring the Theracane just slightly beneath that. It's going to be just slightly beneath that. You're going to set the Theracane right in that spot after you've pinned this down into the wall, and from there you kind of have a little handle here, which is really, really nice. You can kind of use this handle to kind of pry it back and forth. I like to put tape on my Theracane. You guys will see I put some athletic tape just simply so it'll be a little more sticky to the wall so it won't slide off. So what I'll do, again, just pinning it down there so that way it doesn't slide off too much, and then I'll kind of just pry it back and forth onto the lateral fibers. Once I get done getting into the lateral fibers, I can actually start turning my body away from the wall a slight bit and begin to drive in there a little further with that Theracane. And you have to realize that the circumference of the gluteus medius goes all the way around, almost towards the sacrum. So you want to go all the way around, get that entire circumference of the gluteus medius. You kind of just go back and forth and palpate. Let that sucker settle in there. If this is the first time, if this is like the first time you've ever done any kind of myofascial release, specifically on the gluteus medius, I would not recommend going to this right away. Mainly because if you go to this first, it's much more pinpointed. It can be a little bit more of a shock to your nervous system immediately. What I would recommend instead of using a Theracane at first would actually be just grabbing a tennis ball, placing it on the wall, essentially doing the same thing. For me, I'm more advanced. I'm constantly looking for the next things that are going to get into those really deep fascia barriers restricting my movement. So that's why I tend to go for a Theracane specifically. So now we're going to go to the other side. From there, I'm sending it right there to the wall. I just let that sucker settle in. I kind of just use this hand right here to pry back and forth into there. I'll even start involving some lateral flexion a little bit to get to kind of some active release. Just prying that sucker open. And then you can focus on a lot of different range of motion techniques where you can try balancing on one leg and kicking your leg back. The reason sometimes I don't go directly towards an active release for myself personally is that something when you focus on the active release, you take away the attention of how to actually release the muscle in the first place. And my personal experience is that when you do focus on any kind of myofascial release, the most important element is actually palpating the muscle correctly, so that way if the tension does dissipate over the course of time. So if you focus so much on trying to move your body around and going into some crazy range of motion when you're doing myofascial release, you may not get the entire effect, but even beyond that, you may not get the deepest effects, because most of the dysfunctions that are present in most people's muscles are located closest to the bone and not necessarily the surface. Active release doesn't necessarily get as close to the bone as what an actual deep myofascial release trigger point might. So there's a technique for you guys to help you release that tension on that gluteus medius. If you do tend to have knee pain, foot problems, lower back problems, hip problems, pretty much any problems in your body, it's quite likely that you're going to have some excessive tension happening right here in that gluteus medius. This region of the body, again, is for most people, 99% of all people that I've ever met tend to have a very, very tight gluteus medius, and it goes right back to what I explained at the initial points of this video. When you do have those imbalances present in your body, it's only a matter of time before some kind of compensatory movement pattern is going to be created within your body, and then you're going to have those residuals pop up in those other muscles. So I do hope that you guys enjoyed this video and that you practice this technique. It's a really, really great one. Definitely not for the beginners. For those of you that have been doing your MFR for a while, this technique specifically for you. Anyway, I will be seeing you guys soon. I will be putting up more videos here in the near future. Be sure to subscribe to the YouTube channel, and I'll see you guys next time. This is Naudi Aguilar reminding you to live intentionally and not habitually. Take care.